Hi, my name is Carrie Lynn Hilliard, and my topic of choice is workplace morale. My learning objectives are after this presentation, the learner will be able to list 3 costs of low morale in the workplace. After watching this video, the learner will explain 3 strategies that leaders can use to boost low morale. And after this presentation, the learner will list 3 things that lead to nurses having enjoyment at work. Low morale is a problem, and it can be a big problem, which becomes chronic. Unfortunately, it takes time to fix. It takes time to get there, but it's also going to take time to fix. There are many, many causes, which I'll review later. But the good news is that there are ways that we can improve morale in the workplace. Here are some of the many causes for workplace morale. I could list 20 more probably, but we just don't have time to go over everything. No appreciation, whether the employee feels like their boss doesn't appreciate them, the company doesn't appreciate them, or their own coworkers, then people just get down and don't want to be there. If you have an unsupportive manager that you feel like doesn't back you or isn't there for you, that's going to bring workplace morale down. If you have difficult patients day in and day out, you just sometimes get frustrated and it's hard to enjoy your job anymore. Sometimes cliques form at work and then you feel like an outsider. Poor communication can happen when people get low morale and they just don't care as much, or understaffing can frustrate people and make them feel like it's not a place they want to be. So how does it affect nursing practice? Well, it's kind of a domino effect. When people aren't happy at work, then there's a retention problem. With retention problems, then you leads to nursing shortages. And when you have nursing shortages, then there's a lack of teamwork because people are coming in that are new, they don't always fit in, or just takes time to acclimate to the new team. So that leads to teamwork issues. It affects healthcare in many ways. It affects, the biggest thing is patient care. Either, low staffing is a problem or people just don't care as much. Then it affects patients. Training costs are a big issue as it costs money to train a new employee, and sometimes it takes up to 13 months for them to be fully trained and ready to take over a position on their own. Burnout is big when people are overworked, feel like they're underpaid and just not appreciated, which leads to decreased productivity and at times poor communication because people just don't care anymore and don't want to be there. As far as low morale affecting society, it does create lower quality services because people either don't care or there's not enough staff to cover all the services that need to get done, which leads to safety issues because at times if there's not enough staff to take care of the patients, things can happen unexpectedly, and sometimes unsafe medical care happens when either there's a med error or just not enough staff to take care of the patients on the floor, which can just accidentally lead to things that are a problem. So what can we do to improve low morale at the workplace? Managers are definitely key in this. They can make a huge difference. Some of the things they can do are leading by example. They need to respect their employees. They can try to surprise them with just an unexpected little gift to cheer them up. They can ask for suggestions and ways to increase morale. They can help employees feel like they're growing and learning new things. Even getting to them individually makes a huge difference in how people feel about their workplace. But we as nurses can also improve workplace morale by changing our attitudes, by trying to help with the morale by not involving ourselves in gripe sessions, but trying to be positive. We can avoid battles with the employees, but if nothing we do works and we're still not happy, we just need to find another job. But be sure to leave with grace because you may want to come back someday, so don't burn those bridges. And if you want to try to find a way to enjoy your job that maybe you're not enjoying at the moment, try to connect with your coworkers. Maybe share a meal with them. Educate those newer nurses about something that you may be better at, and just support each other in feeling down, but just let each other know you're there. In conclusion, low morale is a problem, but it can be fixed. Even you can make a difference in your workplace. So don't be afraid to step up and be a leader and make a difference. Here are my references, and have a good day.